Estamos hoy con la doctora Sima Porten de UCSF y con el doctor Ashish Kamat de MD Anderson y vamos a conversarte sobre cáncer de vejiga y de uro-oncología en general. Dr. Kamat, what do you think are the most important advances in bladder cancer in the last 10 years?
I think it's a great time for us to be in bladder cancer, and it's a great time for our patients. First off, the recognition that personalized therapy is very important has really come of age. We now have the tools that allow us to allocate treatments to patients. We can still do better, but molecular subtyping, appropriate AI in pathology, appropriate drug targeting. Number two, the drugs. We have so many new targeted ADCs. We have systemic IO agents. We have intravesical therapies. So we now have an explosion of clinical trials and drugs that have been approved, which is, again, really great. And let's not forget technology. In the urology surgical field, technology has improved when it comes to diagnostics, from optical enhanced technology all the way to improvements in minimally invasive technology with the latest Jennifer robot.
Professor Porten, what do you think about robotic surgery for radical cystectomy?
I think it's an important, powerful tool. So if you look at randomized control trials and then also how we do our training, our residents today are more facile and more comfortable with the robot, at least in the US, and I see this also worldwide, than in open surgery. But open surgery is still a very important tool. So I think that robotic cystectomy is a really important tool, but I don't think one is better than the other. It depends on what is better in your hands and what is better for your patient. And you can use some selection criteria and then also your own experience to make sure that you are going to deliver the best surgery and care to that specific patient. And I think that's what's really nice about these new studies and randomized data showing that both are very powerful options in treating our patients.
So you touched on training. What do you think we should do and how we can collaborate in training our residents and fellows in uro-oncology and mainly in bladder cancer?
This is where we can take advantage of some of our international groups and collaborations, and I'll speak primarily just about clinical training. I did the fellowship with Dr. Kamat at MD Anderson, and I was grateful for the diversity of training I got from being exposure to new technologies and also just how to critically think about a patient, as well as how do you stay on top of new research and being able to deliver the best possible care in the environment you're in. I'm now director of our fellowship, and we also run a fellowship in Uganda, which is a completely different practice setting, looking at how do we train urologists there in urologic oncology. Different kind of challenges. I think in today's world, explosion of, honestly, Zoom conferences, the ability to access talks and data in real time. We were able to follow what was happening in ESMO, even though we were here in Chile, and have the updated data, collaborations with groups like IBCG, with also essentially news outlets almost like Euro Today, that can help keep residents and fellows kind of in the know, even junior faculty, but then also exchanges and collaborations through our society. So the different fellowships and visiting programs, right? We have opportunities in AUA for that. We have opportunities in Society of Urologic Oncology, particularly we have a subsection for women in urologic oncology, providing opportunities and travel grants to come to SUO, present research and data, but also there you learn and make connections on what is new and great in bladder cancer. And I think meetings like this in other countries with a diversity of speakers, I learned so much from my Chilean colleagues in Argentina that were here, and I think we can continue to learn from each other.
What would you say, Professor Kamat, to someone who is looking forward to start a research program in bladder cancer? What they should do in a country like Chile and how they can collaborate with other countries or maybe other countries in Latin America?
I think the key thing there, and it parallels a lot to do what Dr. Porten said about training, it has to be an intent. And if there is an intent to do research collaborations, we have avenues to make that happen. A prime example is Professor Mario Fernandez. He trained at MD Anderson the same time as Dr. Porten did. And then ever since he's back in Chile, we've kept in touch and we've done research projects both chart reviews, molecular studies. He's an integral part of the International Bladder Cancer Group. And really, if there's anybody here that truly wants to do research, because I've come to Chile many times and I've met many people that say they would like to do research, my answer always is approach us. Don't be afraid to reach out to myself, Dr. Porten, anybody that they identify in their field that they think can mentor them in the research paradigm. Because we are looking, and like she said, clinically, but also research-wise, we want to learn from you, your experience, your patients, your data sets. For example, the whole arsenic story in Chile informed so much when it comes to toxins and exposure with bladder cancer across the globe. So research is a two-way street, and my message to anybody listening to this is please reach out to one of us and tell us you want to do research, and we will find ways to help you make it happen.
President Porten, there's a lot of residents, there's a lot of trainees, young urologists. What would you tell to those who are considering pursuing a career in uro-oncology? How would you encourage them to do it?
I think the great part about being a urologic oncologist is that we have very mission-driven work. I think it is very fulfilling, a career. You can be innovative. You can participate in research in so many different ways. You can impact patients' lives. You have the opportunity and ability to teach. It's constantly changing and growing. And I think that it's really a great field for anybody who likes creativity and innovation. And so I have loved it. It's been fantastic. And I think you can do it and still have other important things in your life. Family. I have 2 kids. They're 15 and 13. You can still do other activities that are important to you. There is time, and there's time to do important things, and this is one of them.
I would like to thank you for the opportunity to talk today and to have this interview with you both. I think you've given us a lot of very, very important things for us to develop our careers and develop urology in Chile. So thank you very much for coming and attending this meeting.